right. It is 5 o'clock on a Wednesday. It's that time we get together, get an update on where we are in defeating COVID-19, and we remember that we're going to get through this, and we're going to get through this together. Say it with me because I've needed it lately. We're going to get through this. We're going to get through this together. All right, one more time. We're going to get through this. We're going to get through this together. We are going to get through this together because no matter what this virus or anybody else throws at us, we are strong enough, we are united, and we are ready to do what it takes. This is perhaps one of the most important moments we will ever face, one of the biggest challenges we ever have to rise to. And it's one where we are fighting for the lives of so many, and we are rewriting history about how we respond to one of these epidemics. So I know we're going to get through it. We're going to get through it together because we follow the rules about being healthy at work. You knew I'd get back to this directly, I hope after yesterday, but these are the types of rules that are so important once James puts them up, because they're that important, that we've got to make sure become a part of our muscle memory, that we are able to go back to work, to rebuild our economy, to get back to doing what we need to do to revive this economy, but to do it safely. You know, we've got some other states that are seeing spikes, and we certainly have seen some concerning behavior given the way that COVID-19 spreads in other states. I'd like to think that the way that we have, somebody said it the other day, crushed this curve here in Kentucky means we can do it, and we can do it better than others. The thing I'll mention today, nice job, James, right on cue, is the sanitizer hand wash stations. Again, let's remember, because the longer it gets in this, the more we think we don't have to do it, or we cheat in how long it takes. The more we do this, and this has been shown and all the health officials are talking about it, the more that we wear the masks that we need to make, and the more that we wash our hands, the less this thing spreads. So, small thing, one that we can all do, one that can help us get back to at least a new normal as quickly as possible. We're going to get through this because we've got what it takes. We're going to follow the 10 steps. And I got to tell you, people out there, they're together. They are ready. They're together. They are ready. And they are showing how unified we are, and also showing those behaviors on social media that are absolutely necessary to revitalize this economy. Think about it. You and I have never operated in an economy before during a worldwide health pandemic. And if you want to think about it in economic terms, we've never operated in a way where a virus could wipe out our entire workforce if we're not careful and if we're not doing the right things. We've never operated in an economy before where not just the regular health of our workers, but how we protect it and how we set it up is so critical. We've never operated in an economy before where not doing the right thing could impact one or more of our customers and change the way people think about our business. So, we're encouraging everybody to do the right thing. And people are doing that on social media. They're showing off the right things by using these hashtags. Of course, the most recent one, Healthy at Work. But as we look back, Team Kentucky, which so long ago we started this hashtag, one that again just said we're all in it together and we're going to get through it together. So let's see what we've got today. All right, so this is one of our individuals that has gone through the drive-through testing, and we need you to do it too. It's quick, it's easy, and as I read out numbers today, we got some places that are doing well, but others where we know this virus is, where people aren't signing up to get tested. Remember, I've said, the White House has said, the President has said, the Vice President has said, Dr. Birx has said, Dr. Fauci has said, Dr. Stack has said. The only way that we can reopen our economy safely is if we have significant testing, and that requires you, the people of Kentucky, to be willing to get tested and get tested regularly. So we appreciate him showing off exactly how easy it is. All right, I enjoyed this. So Dana is showing how easy it is to do this, to wear a mask to protect one another. It's not a Democrat or Republican thing. It's not a red or a blue thing. As we'll see in a little bit, we've got people encouraging it all over Kentucky. This is a public health thing. This is a science thing. They have everybody, again, from the top all the way down, with any type of background in medicine, says wearing this is critically important if you want to reopen the economy or if you want to protect your family and yourself or other people. All right, we haven't shown this in a while, but again, we have seen so many people out there, here being Ashburn Farms, providing to Maryhurst. You know, Maryhurst has been hit by this epidemic, and the girls that are at Maryhurst have been through way too much to have to deal with anything else. But Ashburn Farms helping out, feeding those in need, making sure that everybody has enough. All right, and this is St. Joe in London. Again, talking about PPE, that people are still providing, still stepping up, still doing the right thing. I remember when just getting an order of face shields would have made my day. And now we in Kentucky are producing more PPE than ever before. And as we go forward in our economy, and we're going to start talking a lot about not just rebuilding our economy, but making it more resilient and where we want to go, making it more dynamic, making it more adjusted to the world that we're living in. The lack of domestic PPE manufacturers is one of the reasons that it took the time that it did to ultimately protect our healthcare workers. We can't let that happen again, and I want to make sure Kentucky is a part of not letting it happen again. All right, Renee found a little hope on her afternoon walk. I meant to show the picture today. There's chalk right outside the governor's mansion. It was kind. It sends the message that my family needed to see. And for everybody that just walks across a rock that somebody has painted, or walks across that chalk that is providing that type of message that lifts us all up, it's important. It's important during this pandemic, but you know, it's important outside of it. We've learned that being good people isn't just the right thing, it's critical to our survival and if we want to thrive, so let's keep it up. And here's Emmanuel United Church of Christ, again, who had 400 ribbons, green ribbons, put up in remembrance of those that we have lost. It's one of the symbols of our unity. It's one of the symbols of our compassion. And you know, this is something we're doing in Kentucky. I don't know if they're doing it elsewhere, but it was organic from right here. And the fact that all of us are participating in it means none of us are alone, and none of the families that have lost someone are alone either. All right, we talk about our social media, which is out there, our top 10 steps. Then we talk about our 11th step, fill out your census. Folks, we are still stuck in 13th place. But again, this is so important across the United States. Think about it as everybody is competing for the same pot of money. Don't you think we should get it? Everybody's competing for the same prize. Don't you think that we should get it? Kentucky is so often overlooked or left out, and all we got to do to make sure that's not the case here is fill out your census. It just takes a couple minutes. And while you're at it, go on the portal and make sure you register for your absentee ballot. This year, you can vote by mail simply by going online to the portal set up by the Board of Elections and requesting an absentee ballot. I did it the other day. It is the absolute safest way to do it. It's one that everybody ought to take advantage of. 145,000 Kentuckians have already requested it. Come on, Kentucky. This is the time where we say there shouldn't be any excuse. This might be the easiest it ever is to vote. You're already on your phone doing something, or your tablet, or on the computer. Go ahead and request your absentee ballot, and we will, at least online, put up the information on how to do that. but I know that it is a very easy, there we go, a very easy link to govoteky.com. I went on there the other day. It took me less than a minute. I have my ballot coming to me. I can fill it out and send it in. It is easy. It is safe. We love democracy. We love our system of democracy. This is the way you prove in a pandemic that we will not abandon democracy. We will continue with the bedrock of our country, which is voting. So go online and make sure that you request that ballot. We're going to talk about it every day. All right, let's move into our update for tonight on our numbers. Then we're going to talk about the importance of masks, and Dr. Stack's going to talk about that. Going to talk about something outside of this, which is a step I've taken today to improve executive branch ethics. Then we will get into testing, talk about Team Kentucky, and then tomorrow we're going to start off our broadcast with a couple of videos for kids. One on masks and one on that anxiety. It's what we showed at the end a couple days ago, but kids didn't know, parents didn't know that kids should tune in at the very beginning. So tomorrow, for about the first 10 minutes, bring your kids in front of the TV, mainly younger kids. It ought to be helpful, a good way to explain some of the things that are going on right now. All right, our numbers today continue to suggest that we are no longer in a plateau, but on a decline. And we'll have to check again tomorrow because of the way that numbers come in. But today's overall number of cases, all things considered, is pretty good on the track that we've been on. So we are reporting 127 new cases of COVID-19 today. After removing just one duplicate, our total number of cases is now 9,077. 9077. Those new cases, 35 are from Jefferson County, 11 are from Boone, 10 are from Ohio County, 7 are from Fayette, 6 are from Shelby, 5 from Oldham, 4 from Bullitt, Davis, Gallatin, Henderson, and Kenton, 2 from Butler, Campbell, Christian, Graves, Menifee, Nelson, and Nicholas, 1 from Barron, Bourbon, Boyle, Breckenridge, Fulton, Greenup, Hardin, Henry, Jessamine, Livingston, Marion, McLean, Monroe, Muhlenberg, Pendleton, Pulaski, Russell, Trigg, and Warren. It's nice to have a day where Warren County hasn't been hit as hard as it has recently. This comes from an overall number of tests now of 200,762. The total number of those that are serology are 18,814. We're going to be breaking those out on our website separately so everybody can see the overall numbers. Total number ever hospitalized, 2,142. Currently, 512. Ever in the ICU, 899. Currently, 82. Remember, we'd had some hospitals over the weekend that hadn't reported, but that number still stayed pretty low. That's a good sign. I mean, it's just a really good sign. 82 individuals we ought to be thinking about. We care about their families. We want the best for them. And we never want 82 people in the ICU, but that's a good sign. And the total number of recovered, 3,124. And today, I believe we have a special video of one of those individuals. No, that's at the end. No, he recovered. All right, this video is of Gary Abbott, a former educator and court bailiff from Wayne County. He entered the hospital on March 18th with symptoms of the coronavirus. He tested positive for COVID-19, and within 48 hours, he was on a ventilator. After spending 70 days in the hospital, 25 on a ventilator, Mr. Abbott was transferred to the Lake Cumberland Regional Hospital Special Care and Rehabilitation Unit. This afternoon, he said with a smile, "I am here because God wants me to do something, to give other people encouragement. When it looks like it's over, heavy-duty prayer is what helps." He picked the song in this video. That's not the video. There we go. Thank you to Lake Cumberland Regional Hospital. Many of us, first of all, probably envision Rocky and Apollo Creed run across that beach. This is always what I'm now going to remember with that song, and I guarantee you it's the first time that Eye of the Tiger has ever played in the Kentucky Supreme Court. So we've witnessed some today. While the recoveries are special, not everybody gets the opportunity to recover. So today we're announcing that we have lost 6 new Kentuckians to COVID-19. That brings us up to 400 Kentuckians that we've lost. 399 are lab confirmed, 1 is probable. But Kentucky, we've now lost 400 of our own to this pandemic. And without all our actions, without heroic actions, would it have been a heck of a lot worse? Yes. But let's all acknowledge that losing 400 people to anything at any time for any reason isn't okay. It's just not. Those are 400 families, 400 communities that are in pain and that are hurting. I never thought as governor I'd stand up and talk about losing 400 people to something that I and we are battling. These 6 people tonight include a 97-year-old woman from Boone County, a 79-year-old man from Jefferson County, a 78-year-old man from Hopkins County, a 71-year-old man from Boone County, a 77-year-old man from Jefferson County, and an 88-year-old man from Oldham County. Let's keep those green lights going. 400. Somehow 400 to the number tonight. And let's commit to doing better. You know, now that we have an opportunity to get out and to do more, now that we all want to get a haircut, and let's just remember that we've lost 400 Kentuckians and this thing isn't over yet. Ring your bells at 10 a.m. Do everything you can to help your fellow Kentuckian. Just like when we had Phyllis George's ceremony here on Monday. It's not the same right now. Even with the 33% capacity now that our funeral homes and others can do, this is a really hard time to lose somebody. And 400 families have had to face that, and they shouldn't have to face it alone, even though we can't get together with them. When you look at race and ethnicity, breaking down total number of cases on race, 74.16% white, 14.61% black or African American, 5.58% Asian, 5.46% multiracial, and on ethnicity, 85% non-Hispanic, 15% Hispanic. And on deaths, 77.72% white, 18.66% black or African American, right at about 2% Asian, 1.67% multiracial, and on deaths, right at 97% non-Hispanic, 3% Hispanic. Long-term care facilities, an area where we have to continue to be vigilant. And I just, I watch some of the cable news at different points, and people are getting questioned about how to do this or that, and they say, well, we just have to protect the most vulnerable. Yes, we do. But remember, it gets into these facilities somehow. It is not just starting there. It is passed between people outside of these facilities and then brought into them. But today our numbers are lower in the additions, and we are grateful for that. 15 new residents, 16 new staff, 5 new deaths attributed over the last several days. We now have over 157 Kentucky facilities that have been impacted. All right, so let's talk for a minute about masks. Masks have somehow become this division amongst people. And yes, they're not comfortable. Yes, they can be hard to breathe from. Yes, they keep people from seeing your beautiful face. But they protect people. And I wear my mask because of my faith, because I believe that I have a duty to love my neighbor and do everything I can to not harm them. And knowing I could be asymptomatic and pass it, it's a very small thing. And I want you all to know that when we look nationwide, this isn't partisan at all. I mean, you look at Larry Hogan, the Republican governor in Maryland, and they're dealing with an outbreak. He had a mandate of masks. We don't have that. I mean, our employers have to wear them because they can't be exposing their clients. But we have just strongly encouraged and will continue to encourage. Our Ohio governor, who I talk to very regularly, talks about it being about loving your fellow human being. North Dakota's governor choked up. I watched this video. I know how he feels. About how on earth did it become something that people are angry at each other about? You know, if somebody's wearing a mask, they're trying to protect other people. Are you really going to make fun of them? Are you really going to get angry with them for caring about one another? And we need everybody to get there. Not by making it mandatory, not by pressuring people, but just by saying if you believe that you are a Kentuckian, a proud American, a patriot, somebody who has values, a good person, somebody who believes in your faith. You know, all of our faiths say that, especially when it's hard, we got to do what it takes to protect one another. I'm going to ask Dr. Stack to come up and talk about it because every single public health professional, that's all of them now, no divisions, nothing else, are saying how important it is to wear one of these masks.
Thank you, Governor. You know, the governor does such a good job of summarizing a lot of these points and explaining them that quite frankly, there's not much more I have to add except to emphasize how important this is. So if you listen to any of the public health professionals, if you from around the country, there's no division on this. There's no lack of consensus. There's no disagreement. That the things that we know are that we have a really bad respiratory infection. It can have other symptoms, but respiratory is the single biggest way that it gets spread. The way we spread that is from secretions from our nose and from our mouth primarily. And the way those spread are when we talk, when we spray saliva, we cough, we sneeze, and do other things like singing and shouting, the stuff that we all normally do in our regular days. And so I think we forget, or because we didn't have the same magnitude of crisis we might have had because we didn't live in Kentucky what they lived through in New York City, we didn't see the horrors at the scale that they've had to see in other places. And I think that that's made this feel too distant and too removed from our present reality. The reality is, if this takes off, if what we started with on March 6th with one patient, and that grew to hundreds of new positives of patients daily, if that trajectory had continued, the hundreds would have become thousands, and the thousands would have become tens of thousands. And when you get to numbers like that, Governor Beshear is not here talking about 400 lost souls from Kentucky. Governor Beshear is standing here and talking about thousands or tens of thousands of lost souls. So it's really important. Now, a lot of us have things we try to remind ourselves either through our faith or through meditation or through reading or philosophy or whatever we do. I think it's a good approach in life to be patient, to be tolerant, to be kind to others. And I saw a governor, the governor from North Dakota, Magnum, I think, talk, and it's on the top left on the screen up there. And like he said, if someone's wearing a mask, it's not a political statement. They may have a child at home who has a chronic medical condition or who has a compromised immune system. They may have a loved one. And some people want to make this about, oh, it's just elderly folks. It's not just elderly folks. And I think that that's unfortunate that people would be dismissive that the elderly among us are not as important as the rest. It's about anyone who has a medical condition that could be affected by this, including our fellow men and women who are in the elderly category. And this simple device, and this is the one that I carry around that was made in our Correction Institute here in Kentucky. This simple device that our inmates made and that we've made available to the state workers and others at the Kroger drive-through sites that we've passed these out to the public. Something this simple is all it takes to keep your secretions to yourself and away from other people. And we've seen the difficulty and the distress that it has caused for us to have to shut down economies at the city, the state, the national, and the international levels. If we want to get away from that and restore some sense of normalcy, we have to do things like this. Now, I'm going to remind people when I talk about being patient, tolerant, and kind, if you choose to disregard the guidance, I don't know that there's much more I can do except tell you that there's consequences, and the consequences may just as well boomerang back to you as they do to someone else. If you choose not to wear a mask, please be respectful of other people who choose to, and be respectful that they may be doing that out of very sincere and deep concern, not just for themselves, but for other vulnerable people for whom they care and love and for whom they may have a responsibility. And if you choose to wear a mask and others are not, please don't pick a fight over it. It's not worth getting angry at folks. You can control your risk of exposure simply by steering a wider path away from those other people. So while I would rather everybody wear a mask, and I want to urge everybody you should wear a mask, and while I think it's a calling, I think it's an opportunity for everyone to be part of Team Kentucky and do a relatively small and minor thing to help keep others safe and keep yourself safe. I want you to be patient and kind and tolerant with each other so that we don't have something like this, which is a simple public health step to try to keep people safe, turn into strife and conflict among ourselves, because we've done too much in the last few months together as Team Kentucky that have shown all the many positive and all the many good things that we're capable of. Let's celebrate those better things we do, those more positive things we do, and not devolve to criticizing others for trying to do what they feel is necessary to keep themselves and the ones they love safe. So thank you very much, Governor.
All right, two quick things, and then we will get to my favorite Lieutenant Governor. First, today I signed an executive order to make sure that we can restore the type of executive branch ethics commission that this state deserves. Some may remember that back in about 2008, the Executive Branch Ethics Commission came to the then governor, somebody I know pretty well, and said it doesn't seem right that the governor of Kentucky, without any type of nominations, appoints every single member to the Executive Branch Ethics Commission. And if we truly believe in an ethical government and accountability, we ought to have some other voices that at least nominate people to that commission. It's the commission that hears and investigates different concerns that go on in our executive branch government. It's what keeps us honest. At that time, that governor, whose name was Steve Beshear, agreed, and he signed an executive order that created a board that had 3 people that he appointed directly, and the other 2 came from lists of nominees, 3 from the attorney, from the auditor, 2 groups that also have a role in ensuring a fair and ethical government. That persisted until 2016 when Governor Matt Bevin became governor, at which point he rescinded that executive order, and during that period Governor Bevin appointed all of the members of the Executive Branch Ethics Commission directly. Today I've taken a step to try to restore the Executive Branch Ethics Commission to what it should be, and to restore it to a point where those other two offices get to send lists of nominees to the governor. So as of today, the Executive Branch Ethics Commission will not be 5 individuals simply appointed by the governor with no input from others. The order I signed today has 3 people directly appointed by the governor, and those that I have put on it include former auditor Crit Llewellyn, a former Franklin Circuit Judge, Roger Crittenden, and David Karam, a longtime serving state senator who has served with distinction. The other 2 members are going to come from a list of 3 nominees to me from the Attorney General and 3 nominees to me from the auditor. Now, for folks out there that don't follow all this, it means that I've taken this from being 5 people that I, a Democratic governor, would directly appoint without input to allowing a Republican Attorney General and a Republican auditor to send names my way. And it's very easy. It's the right thing to do. I've told you all that I am beyond politics, that I want to move this state in a better direction. And this is one way that we are going to do it, by making sure that we are doing the right thing and making sure that we have an Executive Branch Ethics Commission that will hold people truly accountable. I'm excited about the people that agreed to serve, that I'm put on it, and I hope that we will get the same types of nominees, honorable people that will put politics second and good government first, from our other constitutional officers, those 2 offices that will help appoint. And as we move forward, I'm going to try to do more of this. Better government. Government that responds to you and that is transparent. And I hope that you have seen that I've been as honest and transparent with you as I can, telling you when we don't have the answers, and I hope to continue to do that you can know and have the confidence that we're doing the best we can. And sure, we'll all make mistakes at different points, but taking a step like this, I hope show you that we're going to take some of these things that we're doing during COVID-19, the better parts of who we are, and we're going to move forward with them. All right, testing, very quickly. We cannot reopen safely without significant statewide testing. And that's why next week you are going to see us in our Kroger sites, which we are announcing today, which will be in Louisville, Lexington, Elizabethtown, and Bowling Green. People can start signing up for this drive-through testing right now. It'll be 5 days a week in Fayette and Jefferson County, 4 days a week in Warren, and 3 days next week in Elizabethtown and Hardin County. Folks, we need you to sign up for this. And this week has shown what happens if people don't get out and do it. Louisville's doing great. Bowling Green, 270 yesterday out of a potential of 405 in a community where we need to get more people tested. Tomorrow, there's 150 spots left in Bowling Green, and there's almost 300 spots left on Friday. Lexington's starting to fill up, but a lot of spots on Friday. And Henderson only did 45 tests yesterday. As we sit here right now, 106. And there's 400 slots open for tomorrow. So if you'll put up how to sign up, Henderson, Western Kentucky, we want to keep you safe. You've had some major, massive outbreaks, and we want to make sure that you get online, you sign up, and we can provide you the type of protection, but also knowledge that we have to ultimately move past this. And now we're going to get a Team Kentucky update with your Lieutenant Governor, Jacqueline Coleman.
Thank you, Governor. And good evening, Team Kentucky. Wanted to give you an update about the Team Kentucky Fund. We have been up and running for a week and a half with applications open. And as of today, we have about 1,900 applications that have been received and are being processed. As many of you know, we are partnering with the community action agencies of Kentucky to take through those applications and distribute those funds. And I want to make sure that everyone knows that our intention is to make sure that this fund is equitable. So we are using Community Actions Network to deploy funds throughout the Commonwealth so that every single person in Kentucky has an opportunity to receive funds where needed. As many of us know, the COVID-19 outbreak has caused its own unique set of issues. But what it has also done is it has exacerbated issues that we know already exist. As a rural Kentuckian, I can speak to those from experience, because I know that in lots of places in Kentucky, there is not adequate job opportunity for many people. We struggle with health care and infrastructure and internet access in those areas. And what we've seen with this fund is that those disparities are showing up in our application process as well, because we have several counties from rural eastern Kentucky that have a pretty low number of applications. And so I want to highlight those counties and tell you that if you know someone from these counties, or you are someone from these counties who has been impacted by COVID-19 and you've lost your job or you've lost wages, we encourage you to please apply. And so those counties are Breathitt, Fleming, Harlan, Knott, Knox, Lee, Leslie, Letcher, Lewis, Mason, and Wolfe counties. Again, those are counties where we have a lower number of applications than others. I want to encourage you, if you are from those counties, to apply, but certainly to anyone who believes that they need help because of the COVID-19 pandemic, to please apply. It's also important for us to note that when the governor decided he wanted to create the Team Kentucky Fund, our goal was obviously to reach out to Kentuckians across this Commonwealth and offer help financially for those who need it. We could have stopped there. That could have been the end of the road. But that's why our partnership with Community Action of Kentucky is so vital, because it doesn't stop there. Yes, we provide funds and we will help people to be able to make ends meet right now, but the support that you can get from entering the Community Action of Kentucky program continues to pay it forward. You can get help with things like securing affordable housing, with help finding a job, transportation, lowering your income or lowering your energy cost, support for seniors, food insecurity, early childhood education, parenting classes, health screenings, and nutritional programs. So there are a litany of programs out there that once you connect with the Community Action of Kentucky, you will have access to, as well as to the funds for from the Team Kentucky Fund. So because of the generosity of the Team Kentuckians from across the state, we now have about $3.1 million in the Team Kentucky Fund. And so I ask you today that if you can give, to please give. You can donate at donate.ky.gov. Your donation is tax deductible, and 100% of the proceeds go directly to help Kentuckians. If you need to apply, or you know someone who should apply to receive assistance, that website is teamkyfund.ky.gov. Thank you.
Governor Beshear just announced 127 more people tested positive for COVID-19. The total in Kentucky is more than 9,000. We have 6 more deaths in Kentucky for a total of 400. More than 3,100 people have recovered. You can continue watching the governor's briefing on the WLKY Facebook page, but right now we want to get you to some of today's other news headlines. President
And we got Alex who's taking pictures. I don't think he's going to ask questions, though. No? Okay. Let's start with Will.
Just calculating for the voting issue, just your reaction or thoughts on the ACLU's lawsuit involving the voter ID legislation?
I have not read through the lawsuit today filed by, I think it's a number of different groups. It appears to be about the November election and wanting to be able to do the same thing we're doing for this June election, which is really no excuse absentee voting. I think we ought to be able to do no excuse absentee voting at any point in any election. I believe that we can monitor and prevent fraud at this point, that we can apply and do so many different things online. You could go online and request the government stimulus check. Remember during this that the federal government believed that they could ask you enough questions that they could identify you in such certainty that they would even send you a check from the federal government. Well, that's good enough for voting too. We got enough abilities to do it. Now, given that I've been so supportive, I'm not sure why I was named in the lawsuit, but this isn't the first time I've been named in a lawsuit. Okay, this was the same question there. So, Joe.
Terry Bush, the man who was on the EFU, he was fired from his job yesterday, and his wife said that the two of them have been receiving threats. I just wanted to see if you can get your comment on him losing his job and threats that the family says that they were.
The question is that apparently the person who hung me in effigy on Sunday has lost his job. I don't have any comment on that. No, I don't have any comment on that. But you don't simply, in the moment, make a dummy with somebody's face on it and hang it up. And you don't just in the moment march a group over to stand on somebody's porch on the other side of the window pane from where their kids play and shout for them to come out. Now, I know both of those things that have happened have been ways to create fear and show hate to numerous other people in America, and I don't want to claim that I know how that history feels, but I think all of us would say that different decisions have consequences, and I would hope that we would all make better decisions like that as we move forward. I believe what we saw, just like when we see these in other contexts, was an act intended to create fear and terror, and to make the vast majority of Kentuckians that believe in what we're doing and want to do the right thing, that are part of Team Kentucky, bend to the will of bullies. I think we're showing that we will not be bullied. All right, last month we granted early release for over 1,000 state inmates, with about a third of them deemed especially vulnerable to COVID-19. Will more follow? We're looking at that. It will depend on where people's sentences are, what the crimes were. Obviously, they would have to be nonviolent, non-sexual, and how much time is left on that sentence. Lawrence.
The other part of the ACLU's lawsuit seeks to overturn the voter ID law, which you originally vetoed.
Yeah.
You made your comment on that aspect.
And they sued me over that? No, unlike I think some previous people in my position, just because you name me in a lawsuit, I'm not going to get upset. I get all that. Lawrence's question was that there's the second part of the lawsuit that's been filed today, and I'll take your word for it because I haven't read it. That looks to overturn the recent voter ID law that makes it harder to vote, and that for many people would make them take an additional step to be able to vote, even though there is zero history, especially recent history, of somebody trying to pretend they're someone else and submit their vote. I was Attorney General the last 4 years. We never had a valid claim of a person trying to impersonate another to vote. I vetoed that law because I don't think we should be making it harder to vote, and that's part of the lawsuit. So I'm certainly not going to oppose their attempt to overturn that law, because I believe people have a right to vote.
Well, part of the reason they want to overturn it is because they say it unduly, unnecessarily exposes people to COVID-19.
Agreed.
People have to go get this ID. Do you agree?
Yeah, I absolutely agree. One of the reasons that I vetoed the voter ID law, but I tried to be transparent. I was against it in the beginning, was that in the midst of COVID-19, you shouldn't have to go out and stand in a line to get a piece of ID just to vote. So, yes, I agree with that point. And what I asked at the time is, if you truly believe in this, to those that backed it, do it next year. Do it right outside of when we've gotten past COVID, when I think we will have the next big election, the ability to do it safely. So, Joe?
In regards to Lake Cumberland State Park, local lawmakers talked about some plans to possibly close that state park for self-isolated COVID-19 patients, and they are against that and would like to see an alternative plan developed. Can you talk a little bit more about the plans for Lake Cumberland State Park and what other alternate plans you may or may not be considering with that strategy?
Well, right now we've got just a couple of our state parks designated to handle overflow or evacuations when we need them. We just had to evacuate 39 individuals from a senior living facility, and they all went into hospitals, but they won't always need to go into hospitals. We had a situation it wasn't Lyon County, but it was right around it, where we needed, in Western Kentucky, where we needed a place to take people where they didn't need to be in a hospital, but that long-term care facility didn't have the infrastructure to create a COVID wing. So we're looking at all of that. I understand that I've received letters that for tourism, people want to open everything up. We got to balance that with the needs that we have to deal with this pandemic. But we'll certainly look at the needs that we have versus the hospital beds versus where we see the numbers are at different points as we move forward. If someone lives in a bordering state but works in Kentucky, can they get a COVID-19 test here at one of the free sites? I almost don't want to answer that. I believe that yes, if they sign up, they can do it. And they're Americans. We want to make sure that they are protected too, and it also means that they could drive into one of our cities or one of our counties. We'd like it to be as safe to everybody as possible. I don't really want to advertise that, but we'll still take anybody that comes. Mike?
What do you make of the residency and kind of theories about fraud or Twitter recently had a fact check feature, and President critics called this kind of intent to suppress.
Questions about the president's tweets about fraud and mail-in voting. We haven't had a mail-in voting system here in Kentucky in the way that I think he's talking about it and elsewhere. We haven't seen fraud in our election system outside of a number of years ago, a small scheme in a county in Kentucky, and one that was caught. And every time that happens, it ought to give us more security within the system. I believe that our absentee voting that we're doing right now is safe and secure. This is backed by a Republican Secretary of State and a Democratic governor, and both of us, along with the Board of Elections, would tell you that this election in June is going to be entirely and fully secure. Not sure I know about the other examples the president's talking about, and so I won't comment on those. Alex.
You talked about people who get tested regularly, how testing is key to reopening safely. How regularly should people get tested? And since we're seeing kind of numbers of some of these drive-through sites drop off, how do you ensure that the population of people that you hope to test each month will actually show up and get tested?
It's a good question. Alex asked, how often should you get tested? Because we're saying regularly, and we have yet to see that out of the CDC. What I would say at the moment is monthly. If you go, especially if you're going, it depends on your number of contacts, right? If you're staying healthy at home, you're really only going to the grocery store and just doing a couple of other things, the need's not as great. But if you're going to a place of work every day, if you're going to a factory where you're around a bunch of people, if you're going to an office, the more contacts you have, your frequency ought to increase. And so for somebody going to an active work site, I would say if you can do it and you can fit it in your schedule, once a month is a pretty good thought on when and how to get tested, knowing it could take 2 weeks for it to surface. Obviously, if you're feeling bad, you ought to get tested a lot earlier than that. And the second part of your question, that's our challenge now. So our initial challenge was we don't have, first, any test kits because we've never seen this virus before, and then we have test kits that don't work. And then there's a fix, but we only have a state lab that can do it. To now we have a state lab and we have 2 research universities, but we still don't have enough to suddenly, we got the capacity to do 2.5 times the testing that the federal government says that we need, which means that we can monitor where the virus is. We can try to step in and stop it before it grows. The only way we do that is to get people to those test sites. So our new challenge, it's a very new challenge from what we've had, is almost one of encouragement, is one of getting people in and getting them tested. And now, can you put up the test sites? We got them everywhere. I never thought I'd see this, and I know I've said this a number of times, but I mean, I lived, and all of us lived through some days where people who really wanted and probably needed to get tested, there just weren't the tests to do it. And so now it's going to be a part of our civic duty, just about staying healthy at home. Or remember when our civic duty, and it was if you're feeling well but you're nervous, don't get tested. We needed people to do that. And that was the only way that there were enough test kits for those who are truly sick. Now, we need you to go and get tested. We need everybody to go and get tested, because even if you're in a region that hadn't had a lot, you could have one of those really silent outbreaks that's going to grow really quickly, could shut down your economy, and the only way that we can prevent that from happening is to make sure that you are getting regularly tested. And I know that there are some testing going on right now that's not lit up there. I know that Pikeville is still doing a significant amount as well. I did the update on the numbers of people that have requested their IDs. We did have a conversation, not me, with Kentucky Kingdom today. I haven't been briefed on it. Is there any businesses where it would be just as safe for employees to wear face shields instead of masks? We'd have to look at that business. That's an interesting question, and depending on where you are in a facility and what you're doing, there might be a possibility there. There are some places where maybe inside of a factory where you're further away from people, where heat would be such that might be a viable option. But I think that's a pretty specific question we'd need to look at. All right, let's go back through. Will?
Got a question.
You're wearing a WKU mask. See, you can wear a mask, be healthy, and show off some pride.
We've had several people who've asked us about this, teenagers who are in the process of trying to take a driving test.
Yeah.
Is there any guidance on when KSP may allow the driving test? Is there any sort of protocol that might be put into place? Is there a thought process that it may be like Georgia where you would just get a license and have to take a test after the fact?
Question is about driver's license, and that's something that I need to check with KSP on. I know how long people have waited. We want to be able to do it safely. I know we got to get that up and running. Admittedly, we don't have the protocol for that yet, or if we do, I haven't been informed about it. But we'll get you an answer. And I mean, we got it. It's really important to a lot of families about their ability to get to different places, and especially as we reopen and as youth sports start and others. I know that's really critical for people. DJs are being asked to book parties. One business owner has asked you to address this industry. So for DJs out there, I think you ought to ask the same type of questions that we would. What's the number of people? How is the social distancing? If a DJ is being asked to work at a restaurant where the tables are being set up and they're really doing it, not like an example we saw the other day, then it's perfectly fine. But if you're a DJ and you show up and you know that social distancing is not being followed, and it's pretty easy to tell. It's like that party at the Ozarks. You ought to get out of there. I mean, let's not be a part of something where we know that the virus is spreading. I know that's not an easy answer for our DJs, but I know that they are used to walking in and assessing a situation and doing the right thing. Never knew I'd answer a question about DJing. Joe.
The number of cases in Shelby County has risen pretty significantly over the past week, and the local health department says most of those are sick people. Can you talk at all about how that specific outbreak is happening amongst that community there, and are there any steps being taken by the state to prevent the outbreak in
The question is about the Shelby County Health Department and an outbreak that has occurred there, specifically in the Hispanic population. It's one where it's interesting when we see the numbers. We see some disproportionate number of cases for Hispanics. We actually see a lower percentage of deaths, which is something we would all want for everybody. All throughout, but we are seeing additional spread through various ethnic or minority communities at a rate far higher than it should be. Sometimes it can be related to a place of employment. I don't have a read on exactly the reasons in Shelby County. We can get you a report from their health department. Recently Shelby County turned down a Walmart testing facility. And we thought that was interesting, but ultimately a health department and a county judge have to make decisions on that. But we'll try to get you more information. Lawrence?
I'm still getting questions about people wanting testing locations in other parts of Jefferson County, east, central, that area. Right now, that drive across town to get to a test. Any plans to expand testing?
So we are now in the southwest of Jefferson County, having spent over a month in our initial location. And I believe Jefferson County itself, working on its CARES Act money, is also creating testing protocols to move it around. But while this is our drive-through test, and while there are still groups like the Urban League, which are running great, I don't call them supplemental, but they work together, and walk-up sites, really creating some weekend testing that solves a lot of the problems that drive-in testing can't, that are going on. Let's still remember that you can still go to urgent care and all the first care facilities, that if you are sick, you can still go to a hospital, that I really like these drive-in sites. They're really helpful. But now most of your health providers and most of the larger systems ought to be able to provide you those tests. Other Joe.
In regards to child care centers, I know that this will be opening next month, but a lot of the ones that I've spoken to have still issues getting insurance claims. They've been denied.
Yeah. So child care, I know from our end, and Secretary Freelander talked about this, it's incredibly important. We want to make sure there's still the capacity out there. We want to support those facilities. Those connected to state programs, we provide millions of dollars to help them to get through this period, but their insurance companies have basically claimed that they had to have kids in there that got COVID to shut down to prevent the spread. And that is an awful argument from a public health standpoint, and would suggest we would have had to let this thing get a lot worse before they did the right thing. I know they're in court. I support the child care facilities arguments. Those insurance companies ought to do the right thing. Now it's in litigation. There's not a lot of steps that we can take, but let me tell them that I support them, and we're going to continue to do it financially from what we can do from the Cabinet of Health and Family Services. Phil. It's a question about a representative that a couple of weeks ago at a rally in front of the same folks that took the action this last Sunday, threw out as much red meat as possible, used highly charged terms and names, and because of that should have known what a right-wing militia group that has on their website what they believe was likely to do. You know, as an elected leader, you got to take responsibility, not just for yourself, but when you go out and you rile up an unstable crowd, what's going to happen? And people need to take that responsibility. And when you have a history of making statements that suggest you believe in the same ideology, that's really concerning for a state representative. And for anybody that stood in front of that same crowd several weeks ago to mealy-mouth, you can call it an apology or whatever else, but how about this? Not say to the First Lady of Kentucky, I hope you didn't feel unsafe in your own home with your kids. Not one of them that stood in front of that crowd has said that to my wife or about my children. All right, Mike. Oh, we haven't, and that's a good question. Here in Kentucky, we haven't seen wearing masks or not wearing masks lead to any violence or altercation. And thank you to everybody for that. I do think we've seen some instances where people have put pressure on other people not to wear a mask, and we can't be doing that. I think I just said it. We can't. We can't be doing that. Let's just support people's choice to wear a mask, and I'm going to encourage people who aren't to wear one, and that's because it's not just your health, it's the health of everybody around you. But no, we have not seen some of those things that we have seen in other states. All right, Alex, last one. That's a good question. We will get Mark Carter in to give us all an update on the specifics about where our contact tracers are being hired. We did things a little differently than some other states. We awarded contracts to numerous groups so that we can pull people in different regions. You know, we heard from our local health departments, though they admittedly wanted to go a slightly different way on how to do it, that they wanted to make sure those tracers understood their regions. And we have different regions. But we know we are bulking up. We are bulking up as quickly as we can. We're also trying to integrate it because we have one of the only, and it's more than just one, but public health systems where our departments of local health are part state and they're part local, and trying to work all of that together is a challenge. With our numbers right now, I feel comfortable that we are doing the contact tracing, but we're going to have to get a lot better and a lot faster at it as we move forward. And there's still some rumblings, even here in Kentucky, that folks are going to try to say that contact tracing is the government trying to collect your information. Far from it. We're not using any apps. We're not taking anybody's data. What this is what the president, the vice president, all of their health officials and ours say, that if you want to reopen the economy in a worldwide health pandemic, you got to do the testing and you got to do the tracing. All right, so we're going to close today here in the Kentucky Supreme Court. Again, we appreciate having them. Tonight we want to close with something pretty special, especially after Memorial Day. So this is the Daily Bugler. This is John Kuntz, a U.S. Air Force veteran in St. Thomas, Kentucky, who performs taps every night to show his compassion and honor, and to honor those lost to COVID-19. Now we've lost 400 Kentuckians. I think this is especially appropriate tonight. We'll see you all at 5 tomorrow.